Hi, my name is Annie, and today I will present a short note about a cardiovascular topic. My topic today is about 68 years old Asian male. He has a past medical histories of CHF, hypertension, GERD, hyperlipidemia. So he presented today to the clinic with a worsening of bilateral lower extremity swelling over the past week. He say that the swelling get worsening by the end of the day, and he also experienced more episodes of shortness of breath with minimal exertion, especially like walking 1 or 2 blocks during his routine exercise in the afternoon, which he rarely experienced as his normal baseline. He also have orthopnea, which require two pillows to sleep more comfortably. Usually, he only need one pillow. So he denies chest pain, palpitation, dizziness, deny any wheezing, cough, fever, or chill. He's not sure about his weight gain or loss. He say that his symptoms are really affect his daily activity, as including walking and doing his exercise or caring for his garden. He just came back from his vacations for 10 days, so he's not sure about his weight gain or loss, and he admit that he not pay good attention to his low sodium and fluid restriction diet. Um, he but he did really well comply of his medication, especially his basic water pill, and he produced a good amount of urine daily. So, like this is medical list. He have CHF, hyperlipidemia, GERD, hypertension. This is the list of his medication. He took Lasix 40 milligram PO daily, lisinopril and metoprolol for hypertension, Lipitor 40 milligram, PPI, aspirin 80, baby aspirin 81 milligram, and the potassium supplement because of his Lasix. For the review of system, generally he's denied any fever, chill, any weakness or fatigue. He not sure about his weight change, deny any blur vision, deny any change in vision, hearing, sore throat, earache, or difficult swallowing. Cardiovascular, he denied chest pain, palpitation, positive bilateral lower extremity swelling with 2 plus edema, positive of dyspnea on exertion. Pulmonary is positive for orthopnea. He used 2 pillows to sleep. He denies cough, dyspnea, wheezing, chest, chest pain, gastrointestinal. He denied any nausea, vomiting, deny diarrhea, constipation, deny abdominal pain. For neuro, he deny any dizziness, headache, numbness, weakness, lymph, deny any swollen lymph nodes, muscular skeletal, denies joint pain or muscle pain. Um, this is the assessment. So vital signs stable. He have no fever, blood pressure control, no hypertension. He endures 6/10 for leg pain, usually after a long walk. And so compare with his weight. Um, for the last visit in April 25th, 2025, he did have a 1.6 kilogram weight gain. Generally, he awake, alert, answer questions appropriately. He look a little bit like mildly uncomfortable because of the leg swelling. Skin natural in color, warm, dry, positive for redness to bilateral lower leg from ankle to mid calf. He had a normal cephalic, no round, no traumatic neck shuffle. He has no JVD, no midline tenderness, no lymph node palpate. Cardiovascular, normal S1, S2, no murmur, thorax and lung, symmetrical expansion. He have bilateral lower crackle, no wheeze, no stridor, respiration even, unlabeled. Extremity, bilateral pitting edema 2+, from ankle to mid-calf. Abdominal soft, non-tender, active bowel cells, time 4 quadrants. So this is my differential diagnosis. For DVT, which is less likely because patient experience pain and swelling symmetrical for both legs. And then he had history of CHF, so it makes less likely for DVT. The second diagnosis is CSF exacerbation, which is likely a diagnosis because of patient history. His ejection factor is like 37%. He has positive for autopnea, positive for dyspnea, another assertion. He have bow leg swelling with +2 edema, and he also did not follow strictly a cardiac diet for the last 10 days because he on his vacation. Another diagnosis is chronic venous insufficiencies, this which is less likely because patient has experienced a symptom of respiratory symptoms, dyspnea, autopnea, and symmetrical swelling of the leg. So the plan is we will increase the Lasix to 40 milligram PO twice a day temporary. We'll order some lab work, CMP, BNP to check for heart failure, and CBC lipid panel. Also order X-ray because when I heard lung will crackle, so want to evaluate for pulmonary congestion or pleural effusion. Echocardiogram. So patient recently just had it done like a month ago with the EF is 37%. So I don't think I need to order another one. So mostly like education will reinforce patient to comply with the low sodium, low sugar, fluid restriction, and record his weight daily. Also elevate legs while sleeping, and come to emergency room if he experience worsening of shortness of breath or chest pain. And this is a reference. Thank you so much for your attention.